Morning.
Good morning.
Today I'm going to talk a little bit about high blood pressure, hypertension in the African American community. High blood pressure, also known as hypertension, affects African American in unique ways. African American are more likely to develop complications associated with high blood pressure. These problems include stroke, kidney disease, blindness, dementia, and heart disease. Why is high blood pressure common in African America? To date, researchers do not have a definite answer to this question, but some believe that high blood pressure in African Americans may be triggered by the following factors. Genetic factors. High rate of high blood pressure in African Americans may be due to the genetic makeup of people of African descent. Blacks in the United States also seem to be more sensitive to salt, which increase the risk of developing high blood pressure. Environmental factor. Blacks worldwide have rates of high blood pressure that have. In the U.S., however, the difference is dramatic. 41% of blacks have high blood pressure, as compared to 21% of whites. Black people in the USA are more likely to be overweight than blacks in other countries. In the meantime, there's a lot you can do to keep high blood pressure from damaging your health. High blood pressure risks include increased age, excessive weight, a family history of high blood pressure, having diabetes, inactive, high dietary salts and fat, low intake of potassium, and smoking. The more risk factor you have, the more likely it is that you will have high blood pressure or will develop it in the future. Even if you don't have high blood pressure, you can lower your risk by following the treatment guidelines for high blood pressure in African Americans. The top number is called your systolic blood pressure. This number represents the force of blood through your blood vessel during your heartbeat. 119 or below is the normal systolic blood pressure. 120 to 129 is elevated. 130 to 139 and higher is stage 1 of high blood pressure. 140 and higher is stage 2 of high blood pressure. And 180 or above is hypertension crisis. The bottom number is called your diastolic blood pressure. This number represents the force of blood through your blood vessel between the heartbeat when your heart is resting. 79 or below is normal diastolic blood pressure. 79 or below combined with 120 to 129 systolic is elevated. 80 to 89 is stage 1 high blood pressure, and 90 and greater is stage 2 of high blood pressure. Blood pressure changes throughout the day. Systolic blood pressure tends to rise as you get older. Diastolic blood pressure may decrease as you get older. Work with your doctor to develop a plan to treat your high blood pressure before damaging your organs. Treating high blood pressure. If you have high blood pressure, consult your doctor to find out what combination treatment works best. Number 1, follow the DASH eating plan, which is the dietary approach to stop hypertension. This includes eating less fat and saturated fat, limit alcohol consumption, eating fresh fruit and vegetables and whole grain food. Limit your salt intake because blacks seem to be more sensitive to salt. It makes sense to white how much of salt you eat. Table salt and processed food are the two sources of sodium in your diet. So you need to try to eat either frozen or fresh vegetables. Canned food and processed food such as bologna, all of your processed meats has a high rate of salt intake. Watch your weight. Being overweight increases your risk of developing high blood pressure. Follow the DASH eating plan and exercise. Quit smoking. Medication. Please take your medication every day if you're supposed to. I work as a admission nurse. And majority of the patients that came in said that they did not take the medication because they felt good. High blood pressure is a silent killing. Sometimes you don't even know if you have it. So I recommend, if you have history of high blood pressure, check your blood pressure often and watch the intake of salt. Do not add salt to your food. You know, some people get the plate and they start putting salt on the food before they even taste it. Don't do that. We have to watch those things to keep the blood pressure down. Your knowledge of risk of high blood pressure in African American is the first step to controlling this condition. So take your medication, as I say. I had a young man who was a coworker of mine. He was in his 30s, and he came in with a stroke. And I asked him, I said, what happened? He said, I didn't go get my refill on my blood pressure. He said it was over 2 weeks before he had taken his blood pressure. But he ended up having another massive stroke and died. So please, if you're on blood pressure medicine, take it as needed. If you develop any problem, consult your physician to see if they can change the medication, because sometimes you do have to do that.